Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Battery's Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. Today's guest is someone who's truly changing the landscape of endometriosis care. Professor Gaby Moawad is a globally recognized leader in robotic surgery and endometriosis management. He's a board-certified gynecologic surgeon and the founder of the Center for Endometriosis and Advanced Pelvic Surgery in Washington, D.C. Dr. Moawad has dedicated his career to advancing minimally invasive and robotic techniques, combining surgical innovation with deep, compassionate, patient-centered care. As Director of Robotic Gynecologic Surgery and Associate Professor at George Washington University, he's trained surgeons worldwide and helped redefine how we approach complex pelvic disease. He's been named top doctor in Washington, D.C. for nearly a decade and has authored over 125 peer-reviewed publications, leading global conversations on endometriosis and surgical innovation. It's an honor to sit down and welcome a true pioneer and advocate for better outcomes for women everywhere. Please help me in welcoming Dr. Gaby Moawad. We've talked about it being a whole lifelong journey and going back to the lymphatic pathways. If those are involved, does this change how we think about reoccurrence?
Oh, recurrence is like, you get me started on the most complex topic. Recurrence is a very complex issue. Recurrence is extremely poorly understood. Because when we do research on endometriosis, we do research on endometriosis as a whole. We don't have any subtypes of the disease. We don't have any yet well-established understanding of the phenotypes of the disease. How does the disease expresses? Why is it deeply infiltrative in you? Why does it affect the bowel in you? Why doesn't it affect severity of the disease, the genetics and the gene expression of everybody? Also, like the completeness of your therapy, your therapeutic approaches plays a role in persistent rather than recurrence, but we call it recurrence most of the time. So it's a multifaceted, complex situation. Yes, definitely. Lymphatic could play a role. Inflammation, understanding the inflammation. The immune system plays a tremendous role in that. So it's a multifactorial.
Right.
Most of the stuff cannot be answered as of now by one theory or by one causality equation. So there are multiple factors that comes together that we still poorly understand that could increase the chances of recurrence for some patients versus not for other patients.
Yeah. And I think that we oversimplify it sometimes in saying, if you just get the right treatment, if you just get the right surgeon, then you won't have any reoccurrence. And that's just not true. We're too complex for that.
No, there are multiple interventions that we can do. But the most important thing is trying to educate the patient. Because patients, when we talk about recurrence, patient understand there is no cure for this disease. And patient understand there is a chance of recurrence. But trying to help improving the quality of life and minimizing the unnecessary surgery is a goal that could help tremendously impact their quality of life. So if a patient require another surgery in 5 years or 10 years, but in the interim time, they had a very good quality of life, patients are completely on board. They understand really well that. But if a patient has to do surgery every 6 months, and most of them are unnecessary or emanates from the poor understanding of the disease or poor implementing of long-term therapeutic or approaches, this will lead to a lot of frustration, and this will lead to a lot of changing doctors. And so the most important thing we can do as a healthcare provider, advocacy group, is to try to educate the patients about the real reality of the disease.
Yes.
Rather than taking patients' emotional vulnerability to provide them a cheerleading support. Patients with endometriosis, they need more understanding. They don't need cheerleader. Cheerleading is sometimes important. But simplifying endometriosis to go girl, be strong, that kind of approach, which is, I agree, it's important to lift up people sometimes. Right. But the most empowering comes from trying to understand the disease and explain it to the patient, trying to understand their body, trying to individualize their treatment, trying to provide them a longer-term strategy how they can cope with such a disease.
That's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in, and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.